Well, we're back, Andy. We're back on another day, a day in Miami, and today we are from River Landing, and we are at whose offices today, Andy?
We are at the offices of Mr. Carlos Migoya, the CEO of Jackson Health System, our public hospital system here in Miami-Dade County.
Okay. And what else can we say about Carlos Migoya? Is he a good tenant?
This is a great tenant.
I think we're paying on time.
Carlos is
we do.
Carlos is a great tenant, and I think he's going to take the rest of my empty office space, too.
Oh, we're going to go ahead and put that on camera. Well, anyway, Carlos, welcome to the show.
The right rate?
Yeah.
There we go.
Too much money already.
Carlos, welcome to the show, brother. We appreciate it. We appreciate you, being here. No, well, we'll save that one for another. We can't say that one now. That was off air. Listen, we appreciate you taking the time. We know how busy you are. And, but, last time we were in the other podcast, Andy had said how important I think, and it is, the fact of having you on the podcast, especially, the importance of what the Jackson Health System represents for, Miami in all. So I think that before we even get into other questions, I think one of the most important things is for you to explain a little bit of, because everybody, when you talk about Jackson, so quick little story. I worked at Jackson when I was very, very, very young before I got into
a candy striper?
No, before I got into the political world. I by the way, I did good money, by the way.
I can see him again.
I look good in pink. I did a little internship here with in radiation oncology when I graduated from business administration. I worked here in the University of Miami area in radiation oncology, right next to the Jackson cafeteria, which was great. But anyway, at that time, a lot of people, you would say Jackson, and nobody really understood, what Jackson was. Like, what the people that would come to Jackson, I would try to explain to people, this is one of the best places you can come to for medicine. It's a school and this and that. But perception-wise, and people around the streets, it's like, oh, well, is it Jackson just like for, I don't know, the homeless or for this or for that? And I would try to explain to people, Jackson is one of the best places that anybody can come to. I mean, in another note, my sister years ago got into a car accident that somebody ran a red light, and she was airlifted here, and they saved her life here. So again, that's just a little bit of the fact of what I know about Jackson, hospitals, but I think it's important for people to get your perspective of what the Jackson Health System represents for the city of Miami.
But people should know that Jackson Health System here and the University of Miami, which is in this health district, this is the second largest health district in the United States, and Carlos runs that.
That's why I said I wanted to Carlos to go ahead and explain the fact of the importance of Jackson Memorial and what it represents here, especially the School of Medicine and everything else that it provides.
We are the largest public hospital system in the country, and we're one of the top 3 teaching hospitals in the country. We have 1,100 residents and fellows, and we graduate 300 doctors every year in 95 different specialties.
What are the three major ones of teaching here?
Well, surgery is one of the big ones.
Okay.
Anesthesia is also very large. I can't think of who the third one is, but those two are two of the top programs
ones
that we have. I think we have the largest anesthesia program in the country, but we're training people here not only from the United States but from all over the world. Example, we were just discussing this the other day. Half of all the trauma surgeons in Israel were trained in Jackson.
Interesting. I didn't know that.
Because the relationship we have with Israel goes that far back. As a matter of fact, we have a couple of fellows right now here that are training that when they go back to Israel, they'll be directors of trauma centers in different parts of Israel.
Okay. You got anything else? Yeah, I didn't know about that. I don't know about the fact of you see, those are things that, again, that a lot of people don't understand, and that's one of the things that
And part of the training piece is for the last 25 years, we've been also the training hospital, part of the trauma center for all Army surgeons that go offshore.
Okay.
So when people didn't even know what telehealth was, we had a little robot that we called Chico. That he would go around and actually see the patients in intensive care and trauma, because in trauma ICUs, all the surgeries that are done, they have to have open wounds and then let them heal by itself. You can't suture them because of the kind of issues that you have. So higher propensity for infection. So Chico would be the one that would be doing the roundings, and then the doctors and nurses will be in a conference room. That same methodology that was being used, or technology that was being used 20 years ago, was also the fact that we had cameras in operating units, in MASH units in Afghanistan or Iraq, wherever the Army was, and if they needed some counseling or needed some coaching, our surgeon would be here watching the surgery and will be telling the surgeon what the things they need to be working on.
But would they have the Chico over there too, or just?
Well, it would not be Chico himself, but it would still be a camera that would actually be done. And this is 25 years ago. With it, that technology was really rare. So that was probably the beginning of telehealth.
And that was originated here.
That was being done here before anywhere else. We needed to do it because we had all these surgeons, Army surgeons that are all over the world, and especially back then. Remember, after 2001, we had Afghanistan was the first place that we went to after 9/11. So therefore, we had a lot of surgeons over there, and they would need a neurosurgeon or whatever specialty would be watching their surgery, and any questions or coaching would be done through the internet.
Wow, that's a good one. That's a good story. I mean, that's a hell of a story.
That's a different way to do telehealth.
Yes, it is.
Especially with Chico.
Telehealth surgery with Chico.
Oh, God. So, Carlos, tell us a little bit of how Jackson came about. Like, what was when the beginning of Jackson, what was the...
Well, that's an interesting thing, man, because the beginning of Jackson was 1918 with the Spanish flu.
Okay.
It was the last infection before COVID that hit worldwide, and here there was the head of the Department of Health was a guy named Dr. Jackson.
Okay.
And he created this hospital originally, and I think it was Miami Hospital was the original name of it, was to deal with the Spanish flu and patients that were impacted by the Spanish flu at the time. What people don't understand, the Spanish flu still exists. There's people who still get the Spanish flu. They don't call it the Spanish flu anymore, but that infection continues. So when we had COVID now, 4 years ago?
Yeah.
And people used to say, well, experts in these kinds of things talk about you guys are doing it wrong. And I said, how old are these experts? Because the last time we had one of these things was 100 years ago. So it's an interesting scenario. So to be truthful, that we started here through infectious disease and even outside of COVID, because Miami is such a gateway for the entire world, we do get a lot of people that have infectious diseases from all over the world, whether it's Latin America or Africa, Asia, that come through here, and Miami gets it before any other parts of the country. So a lot of the infectious diseases get researched and really understood what they are here before a lot of parts of the world.
Wow. I mean, so, if you think about it, Spanish flu was like, to your point, the first big thing here that really wiped out so many people.
Well, obviously the one before that was bubonic plague, but that was good 500 years ago.
But I did not know about the fact that that's how Jackson originated here.
And then a few years later, I don't know when, they named the hospital after Dr. Jackson, which is how it became Jackson Hospital.
And for years, it was considered the county hospital and almost your hospital of last resort. Today, it's not considered that anymore.
It's still a county hospital. We still are a county hospital. That's why it's a public system. But when you think of a county hospital, Jackson is not what you think of, because in a lot of places, the public hospitals are the hospital of last resort, and we are the hospital of last resort because we pride ourselves. Our mission is that we provide the best quality of care for all Miami-Dade residents, regardless of their ability to pay. So if you have a brain tumor and you need a great neurosurgeon to operate on you, whether you are extremely rich and have all the ability to pay, or you're poor but are a Miami-Dade resident, you still have the same surgeon that takes care of you.
Well, that's what I was originating when we started the conversation. That I said, when I worked here, everybody had that that mindset of what Jackson was. And to Carlos's point, you could see here the best neurosurgeon either being an indigent patient or be a person that can pay for it. So that, I think, gives the whole really fact of what Jackson really represents, I don't know what I can compare that to anything else in the United States.
There really are no other public hospitals
Correct.
like that. For example, and this happens going back to our partnership with the University of Miami. University of Miami started their medical school in 1952, and we were the partner hospital that residency programs were here. Actually, we had residents before the University of Miami had the medical school. We had residents here going back to the 20s. So we've been training doctors almost 100 years at this point, or probably 100 years. But the partnership with the University of Miami goes back to the inception of the medical school in 1952. So that's how we built it together as to the programs. And for that reason, we have one of the largest transplant programs in the country. We have 17 neurosurgeons that do, and not a whole lot of places have that. And we have a top open heart program. In neurology, one of the top stroke hospitals in the country is right here. So we have a lot in our neonatal intensive care. We have 126 beds for preemies. And my younger child, who's now 46 years old, was born here in 1977. And he was a pound and a quarter and only survived because he was born in Jackson.
Right. Well, I want also to just elaborate a little bit on the fact that everybody knows you as the fixer. I feel like that's a good little.
But don't give me a wrench, whatever.
No, but I think I think you're, ever since I've known of you and everything else, when there's a problem, there's been turmoil, what everybody says, who do you go and seek out? You get Carlos. Carlos can come and fix it. There was a time that Jackson was in a turmoil, we can say, right? And people tapped into you, the fact of bringing in. Could you elaborate a little bit on the fact of, obviously you've taken this to another level, and I'm not telling you because you're on the podcast, but everybody knows that you've taken this to another level and another notch. What has changed in what do you feel has been the biggest change in the medical landscape that you've seen?
It's not so much the medical side as it is more the business side.
Okay.
To Andy's point, Jackson was known as the county hospital and a hospital of last resort. We made sure that people saw Jackson as what it is, an academic hospital. Yes, we are a public hospital, but we're also an academic hospital. And we have some of the top-tier specialties anywhere. So we wanted to make sure that people saw Jackson as the place that they need to come to for anything that they need. And, of course, we also take care of those that can't afford to pay. But the medicine here is great medicine, has always been great medicine. And, frankly, in 2011, when I got here, the hospital was more reliant on public funding, federal fundings and those things. And as you know, now for the last 15 years, the federal government, the state government, everybody's looking to reduce their spending. Medicaid and Medicare are some of the largest costs for the federal government, so they're trying to dramatically reduce those. So they're not looking to pay anymore. So we needed to make sure that Jackson became attractive to all patients, especially the paying patients. Is what we call the healthcare Robin Hood, which is to have insured patients come in, so the profits we make from that can pay for the uninsured.
Correct. Well, and by the way, it helps a lot because I try to attend every year and everything with the Jackson Foundation. You know what I'm saying? How it helps, help raise funds for that to go ahead and help out with the Jackson system. Do you see a change when we did the whole penny thing did that, also help out with?
Oh, that helped tremendously. When I got here in 2011, Jackson was losing $100 million a year. We turned that around rather quickly.
This is why he's a fixer.
Same year.
This is the reputation right there.
But what we didn't have.
See what a penny does?
Yeah. What we didn't have was working capital.
I know where you're going with that, but go ahead.
And we didn't have the working capital. So what we did in 2013, and this goes back to everybody having a Jackson story, we said we need to have a down payment towards capital expenditures. Jackson had not had any capital improvements in over 20 years. Everything was old and needed to be replaced. So we came up with a half-penny sales tax to do a general obligation bond that the voters of Dade County passed, which is an ad valorem half-penny. It's not really a half penny; it's an ad valorem tax, is what it is. The half penny was in 1992, but anyway, the ad valorem was that the taxpayers of Dade County, the real estate taxpayers of Dade County, taxed themselves for an $830 million bond. And for quite a while, especially back then, the taxpayers did not want to increase anything, but we passed that general obligation bond by 65%. And that was because everybody in Miami has a Jackson story, whether it's for themselves, for a family member, for a friend. Somebody's life has been saved at Jackson, whether it's a car accident or something, or a tumor or something. So that helped us tremendously. And that $830 million was the beginning of capital improvements over the last, say, 8 years now. That $830 million was a deposit towards $2.5 billion that we've done in capital expenditures. This is the 6 urgent care centers that we built. We now built a world-class rehab hospital, the Lynn Rehab Center, which is one of the top 3 in the country. We built the Doral Hospital, Jackson West, and we've
that's huge, by the way. That was very needed over there.
And
here,
we built here at Jackson Memorial an 85-room intensive care tower. Jackson Memorial today has 170 ICU beds. That's more than a lot of hospitals have total beds.
Yeah.
But the kinds of things we do here, the complexity of what we do between spinal, brain, heart, and transplant, we need that kind of number because of the number of people that have those kind of serious surgeries.
So I'll tell you the importance of that $800 million bond. We bought what is now River Landing in 2012.
Right.
And the county passed the bond.
You bought the land.
We bought the land.
Yes.
And the county passed the bond, and it showed that this area would have growth. And it was important when we went to the markets, to Wall Street, to investors, to capital markets, to show that there was a commitment by the county to grow here. And the bond was one example of that by the county. So little did you know, when you petitioned for all that to make that happen, you were also helping us out. Not just being a tenant here.
Another welcome.
Another welcome. That's two welcomes.
Two welcomes.
In the middle of that campaign, Andy came to pitch me about River Landing in 2013, and I thought he was crazy. I said, "There's no way."
I could be crazy. Let's be clear about that for other reasons.
You know,
I like the crazies.
Very good point. Very good point. You're insane, but that's a separate conversation, and we would probably need some alcohol to discuss that.
We usually have tequila.
But I have it downstairs. Do you want me to have it shipped up?
As far as the development of this property, back then, which was, I guess it was a Shriners is what was here.
Shriners,
right? Shriners are here, right?
It was like, are you kidding me? What and obviously what's happening in this area in the last 20 years is it's unbelievable. And this building now, River Landing, has become the anchor to a lot of, obviously everybody at Civic Center, which is right across the street here. They come here for lunch because there's no other place for them to have lunch. And the
residents that live around here,
the future growth. The beginning of residency. I think you're going to see a lot more residents around here because look how close we are to downtown. Look at the proximity to the expressways. It's a great location.
Whoever doesn't understand this area, for me, this is a city within a city. I've always said that if you don't understand the whole area of Jackson, you can get lost here because there's a city within a city.
Drive around here, you'll know it's a city.
Yeah, it's crazy, you know.
And I think I told you back then. I said, you're going to grow the health district. You're going to need to be here. And here you are.
Yeah, exactly.
And then here we are now.
Here we are.
You see how everything just turns and turns and turns and turns. So anyway, I wanted to get into the fact also of so where do you? We've reached all these heights with Jackson. Where do you still want to take Jackson a little bit more?
Well, there's a lot of different things that we're doing for the future of Jackson. Right now, we're building at Jackson Memorial here the largest emergency room in the country. We're taking our emergency room that is today 47,000 square feet and building a 176,000 square foot emergency room.
Wow.
That emergency room will be bigger than the hospital building itself of Jackson West. That's how big that'll be. We today at that emergency room, we take care of about 125,000 patients a year. About 20,000 of those are children. And we're bringing it, and it's very, very tight. We got it on Friday and Saturday nights can get really crazy there.
And that trauma center is not just for Miami-Dade County. You also get trauma coming out of
the trauma center,
right?
which is one of only 2 standalone trauma centers. That's a separate conversation. In the emergency room, once we complete it, we'll be able to take care of up to 200,000 patients a year. And with the growth that's happening in this area between Brickell and Wynwood and all around us, plus right here on this site, we believe that we'll see 200,000 patients in less than 5 years. So we need to take care of that, and so that's important. The trauma center, which was built in 1992 now, was at a time in which every hospital in Dade County decided that trauma was not profitable. They shut down their trauma, and the community here voted a half-penny sales tax at that time to build the standalone trauma center. There's only one other one in the country. That's at Hopkins in Baltimore. It's called Shock Trauma. And Ryder Trauma here are the two only standalones. And this trauma center not only has 8 bays for trauma, has another 14 beds like you see in a normal emergency room, has 26 ICU beds, has another 60 beds for a regular inpatient, and has a 40-bed burn center. So it's a hospital in itself. And an additional 6 operating rooms
with the writer's rider.
That's strictly separate of the trauma center.
That
doesn't
crazy.
include the 45 operating rooms we have at Jackson Memorial.
That whole thing of the emergency room. I mean, do we see so much really? Emergency.
Emergency room is that busy, and but we believe that when it's old, and frankly, once we have a brand new facility, we believe it will be a lot more attractive to a lot of people up here, which again will attract the paying patients and not just the unfunded that will also come here and help pay for the unfunded.
Well, but that again, from way back that I always remember, people around the world that had money would want to come here.
They still do.
And they still do. You know what I'm saying? People from any other country or whatever, they say, I want to go to Miami, I want to go to Jackson.
And they do, and they want to come here when they want to have surgery. They want to come here.
That's what I'm saying. I mean, it does to
elective surgery.
Elective surgery. That's huge. That's huge. So basically, we're going to take that now to another level with the emergency room. You mentioned the urgent cares. Is that something that we're looking like getting into all the different other neighborhoods around Dade County?
When going back to 2013, when we went through the general obligation bond. It was quite evident at the time, as we know, Miami-Dade County has gotten to the point that if you're going more than 3 miles anywhere, it's very difficult to get someplace. So we thought having the Jackson Medicine closer to the community was important, which is part of the reason why we built the Jackson West Hospital. But we also felt that having urgent care centers throughout the communities was also important because you want to be able to have that kind of
People love the urgent cares.
And so we built 2 down in South Dade. We have 1 in Miami Gardens. We have 1 in North Miami, and we have another 1 in Coral Gables. So we have 6 urgent cares altogether. We're looking to expand those further. We're seeing between 1,000 and 1,500 patients per month in each one of those urgent cares. So they're very busy, and they're not open 24/7. They're open 7 days a week, and they're open from 7 in the morning to typically 8 o'clock at night. But they stay quite busy, and that's an important piece. So, and urgent cares today are becoming a lot of the primary care. A lot of the younger people don't care to wait a week or 2 weeks to go see a doctor, and they look at their urgent care as a way to take care of whatever their needs are.
I'll be the first one. Right. I think that's the best thing because people, not to get on a appointment with a doctor, and people just say, let me just go to the urgent care. Yeah. You get the service right there immediately with the fact. Carlos, on another note, where do you see, so I talked to you from perspective of having kids. Have you seen a decline or have you seen a little bit more of people in the medical field? Like a lot of people wanting to study doctors still, like nursing.
That's interesting you say that because obviously it was said at the time, which is true, during COVID, a lot of people in healthcare got burned out with healthcare. It's understandable when you have a new infection that comes in, a virus or whatever you want to call it, a bug, that no one seems to know what it is, and you're taking care of patients like that all day long, and you have to go home and potentially pass that on to your family. It's not a fun thing to do. But a lot of people had a calling and made sure they stayed and did that. Some people said, this is not for me anymore. So we started seeing a decline of people getting out of the healthcare business. What we also found was, and we found that here in this community, we did a lot of surveys and really understanding, there's an awful lot of people that felt because of COVID that healthcare was a pretty cool thing to do, and they wanted to go into healthcare. So we partnered up with Miami-Dade College, where we started giving jobs to people at low levels, whether it's transporting patients or whatever they were doing, or working in the cafeteria or whatever, and at the same time giving an opportunity to go to Miami-Dade College. We would pay for their education and be able to then become techs, whether it happens to be in radiology or lab or nurses or whatever they want it to be, and move up the organization. And we've been quite successful with that. We got a stabilized workforce. We have one of the lowest turnovers of any hospital in the country. Our turnover today is 6%. The average in Dade County is 18% for hospitals.
And is that a current program that's happening now?
We started it. What was that? 22, and it's very heavy, and we're still doing it. We have several hundred employees that are getting programs at Miami-Dade College. And Miami-Dade College Medical Campus is right across the street from us here on 10th Avenue, right across from the Trauma Center. So we have it with them, we have it with FIU, and we have it with the University of Miami. All three places have it.
I think that's really encouraging for a lot of people, because again, the people I talk to from universities and all that, some people are saying, well, I don't know if I want to get, people that really want to get into the medical field, and they're not thinking about the medical field anymore. And I think that's very encouraging. I didn't know about that whole.
And then the other thing we're working on right now, which is still a long term away, which is part of the reason we ended up in Andy's building here, is we have an old administration building that needed too much money to renovate.
Right.
So what we decided to do was tear it down, and we put an RFP that has already been awarded. We're going to build 800 workforce housing units, at 2 towers for 800 units, plus a 128-room hotel on campus, right on 12th Avenue and 16th Street, I think 15th or 16th Street, between the rehab hospital and Sylvester, and for our own employees. But in addition to that, we're looking to build schools, everything from elementary through high school. And the high school specifically,
wow.
And we're talking to the superintendent right now. He's very interested in, will be a high school related predominantly to healthcare, so that people that kids that go to high school.
A charter school just based on.
This is not a charter school.
Right.
Well, it could be a charter school. We don't know exactly. It could be a charter or a public school.
Okay.
I mean, charter schools are public, but I mean, it could be either the school system or a charter school. We're still working through that. But the idea to have a high school that is focused more on healthcare, so that the kids that go through there were to be able to graduate, and if they don't want to go any further, they can come out with a tech certification and start working.
That is a great idea.
That's awesome.
And then they also can then go to FIU, Miami-Dade, or UM and get nursing degrees or whatever, or they could go on to college and become doctors. So the idea is, and because we're going to have 800 apartments there with families, there's going to be a lot of our employees. Think about this: between the University of Miami and Jackson, we have 15,000 employees that work on these campuses right here. Going back to Andy's previous point about and that doesn't even include the VA. So obviously they have families, and they have kids that may want to go into healthcare. So having the high school here on campus is an attractive choice for those kids to go to school.
Is that in the progress? Is that it's still in negotiation stage?
No, it's a vision right now.
Okay.
Like everything else we've done around here, the vision will become a reality, and everybody we've talked to really likes it. As a matter of fact, Michael Bloomberg,
Sure.
as you know who he is, created a $250 million fund to help create high schools throughout the country focused on healthcare. And that's one of the things we're going to be working with.
Awesome.
I did not know that.
This is the things that we like to bring into A Day in Miami, to our viewers out there, all our followers, because we try to bring stuff that people didn't even know that's going on. I mean, not for anything, It's a vision right now, but that's great. I mean, imagine all the people that could be looking into this that said, I never knew I wanted to get into that, maybe to that field, and now they have something to look for.
Yeah, it started with the workforce housing because, as we all know, the cost of housing in Miami has gotten very, very
crazy.
Expensive. And if you've got people like we do that have salaries anywhere between $50,000 to $120,000, even though that sounds like a lot of money, it doesn't cover a lot of rent. So therefore, having workforce housing is important. So we started creating that 800 apartment buildings that we're doing. That's about 3 years away. But in addition to that, Related Urban, which is actually the ones that are going to be building our building, are also right behind our transplant building, Miami Transplant Institute. They're also building another 400 units. That one will be ready to go in 2 years, and that will also be priority to healthcare workers. So
I already see your future. You know where your future is going to be.
My future.
Carlos could go ahead and incorporate everything, and then this could be a new city, and you run for mayor.
yeah, right. There you go. Exactly.
You're going to run the campaign, I'll bet.
Just what
You
you
can
wanted
run
to
this
be.
That's what
right?
I wanted to do.
That's what you wanted to
That's right. I need another.
Hell, for that, everything that's going to happen here between the hotel, the housing, and everything, we should just incorporate.
be. Well,
this.
and that's just us. The other people.
Put another
think about
bullseye.
it.
Thank you. Put another bullseye on me.
The state attorney and the public defenders are also talking about trying to figure out public, workforce housing.
Yeah.
Which I know the county is working on.
I mean, it just
on
makes so
doing
much
that.
sense. I mean, it'd be
But besides normal market rentals in this area, which are definitely going to go up, they need to have workforce housing for. I mean, and for all these professionals, whether they happen to be on the legal field or the healthcare field, it's extremely important for this area as well.
I mean, think about it. If you're gonna if you want to study here, and you can have the fact of just living around here, going to the school here, everything. I mean, you keep everything in house. I mean,
This is an easy lifestyle. We have a lot of UM students, residents, doctors, Jackson employees that live here, and they just take the shuttle. The shuttle picks up right out in front. They go over to the campus. They'll walk back. It's a different lifestyle.
The shuttle goes around the entire area, the district, and in addition to that, we have Metro Rail also on 12th Avenue, which if they want to go downtown to go have dinner or anything else, what's happening is it's becoming a mini New York where people really don't even need a car anymore. Between the shuttle and the rail and so forth, they can move around very easily and not have to even have a car.
Well, listen, I think that it's important for all the viewers and listeners of Day in Miami to really be in tune to what's going on. That's our goal always in the program, and the fact of giving them information. And from this we're going to get a lot of other questions. So we always follow up maybe with another podcast with a whole bunch of other people, other questions. But before we even wrap, one of our biggest things that we like to do, and Eddie's not here, but it's Eddie's biggest thing. And I don't want to put you on the spot, but you can throw a little bit out there. 3 go-to restaurants that Carlos says, this is my 2 go-to, comfort food or fast food. 3 places that our viewers would say, where would Carlos Migoya go?
And no pressure. We have a few downstairs.
It doesn't matter, but we always do that in the program. We always like to put that little out there.
Well, actually, I'm going to lunch today there at the Japanese restaurant here on
Tanuki.
It's really
there you go.
I'm a partner in the Nobu Matsuhita brand in Colorado, and so I'm pretty picky with my fish. And I think the restaurant here does a pretty nice job with the fish. So I really like that.
Oh, thank you.
Check for
box.
Andy.
Check that box.
My number one here is El Gabbiano downtown. I love.
Okay.
I think it's a great restaurant. It's great. It's probably one of the best Italian restaurants anywhere. The guys that started in Molina, New York, and I think they do a very nice job. And there's a hole-in-the-wall Thai place in Coconut Grove called Achana, which I go to all the time.
You see,
right on Grand Avenue. So if you're looking for 3, there's a go.
That's what we love. I mean, because our viewers always love to say, "Hey, what's those 3 little places that people would go?" I didn't even know about that one. Tell you the truth.
1 out of 3 here at River Landing, right? 1 out of 3 in baseball, we'd be making a lot of money.
Which is
1 out of 3.
Oh,
30%.
Okay.
Not bad.
333.
You have my
333.
favorite fast food here, anyways, with Chick-fil-A, so I have no issues. I resolve quickly with little grilled chicken nuggets.
Remember, spring practices already started, so.
Well, listen, I want to thank you. I know you're a busy guy, and I want to thank you, and I want to thank Andy. We really wanted to do this podcast because, again, our thing is informative, and we really want to, put it out there to people. And I think there's a lot of stuff that we touched on today that people did not know about.
There's a lot of people that don't know what happens
I got a question,
at Jackson.
Andy. How'd you end up hooking up with Manny here?
It's another long
That's
story.
another
Maybe
long
you don't
story.
want to even bring
That's
that up.
another long
That's
story.
another long story.
That's another long. Friend of a friend connected some dots, and we became friends.
There you go.
But it's a good friendship.
It's a good friendship.
It's a good fit. Andy's a good guy.
We have a lot of fun.
Yeah. Especially when it comes to the Gables.
Oh, especially.
We crossed to the plaza. And then there's tequila involved.
It's just lots of tequila.
Always with tequila, things happen. Carlos, thank you, my brother.
Thank you, Manny.
Appreciate it. Really
Thank you for doing this.
And to the whole team, the back people here team. Thank you, Bensters, our producer. I don't know where he left, but anyway. Thank you so much. Okay.